Hello and welcome to my channel. Thank you so much for being here. I'm glad to have you. And before we continue, I'm requesting you to kindly subscribe to this YouTube channel and click that notification bell so that whenever I have a new video, you'll be notified. And yes, that is it. And I'll be very glad when you subscribe. Kindly do subscribe to this channel so that you can get the latest tips on health. The previous video we introduced this health show, and on the same video we introduced a topic, and if you have not gone there, kindly go listen to that previous topic about health. And today we are introducing another health topic, and the topic is about UTIs. What are UTIs? UTIs are urinary tract infection. These are infections caused by bacteria that are just within our bodies, and I will tell you how they affect us, though they are inside our bodies. And to inform you, the urinary system normally consists of the urethra, the bladder, the ureter, and the kidney. That is the urinary system. And with that, in our body, we normally have bacteria that are called the normal floras. If they're not where they're supposed to be, that's where the disease comes from. Like for this case of the UTIs, we will come across the bacteria that cause the UTIs, though they are good in some part of our body and they do not affect us. So most of the infection normally involve the lower urinary tract, that is the bladder and the urethra, because the colonization of the bacteria normally start from urethra, and by the time they are getting there, since that bacteria that affect and cause the UTI is not where it is supposed to be, you will have had signs like pain during urinating, those discomfort. You'll have the discharge that normally change into color, not the actual normal discharge that normally comes out. So some of the bacteria that normally cause the UTI involve the E. coli, that is the Escherichia coli, the Klebsiella oxytica, the Proteus mirabilis, and the Pseudomonas aeruginosus. But the most that causes this UTI is the Escherichia coli that come from the stool. So how does it get transferred from the stool to urethra? Is how you do your business inside there at that washroom. You are supposed to wipe yourself from front to back, but if you do the reverse, that is from back to front, that is when you introduce the Escherichia coli into your urinary system. So when the Escherichia coli colonizes the urethra, you'll have those other changes of the discharge and the discomfort during urinating, whereby you get that it's like burning sensation during urinating. That's what you will feel. By the time it is getting to the bladder, you will experience things like the pelvic pressure. You'll have that abdominal pain because the bladder is already infected by the bacteria, and that bacteria is not supposed to be inside there. It has just been introduced, so it is foreign, and it is supposed to be on the other side of the stool. That's why I was telling you there are bacteria. Those bacteria are referred to as normal flora. What do I mean by saying they are normal floras? Those bacteria are only supposed to be at certain part of the body, but if they are transferred from that point to another part of the body, they can cause diseases. That is in case of the Escherichia coli that I've just talked about. When it is moved on the stool to the urinary system, it affects the urinary system. So in this case of the UTI, women are at a most risk than male to contact the urinary tract infection. Why? Because the distance between the urethra and the bladder for female, it is normally shorter than that of the male. Are you getting me? Yes, get that system of the male in you and that of the female. Which one is longer to the bladder? So women normally, they are mostly affected, and the most affected age is the age between 20 to 50 years. It is normally like two-folds more common in female than male, because at the age of 20s is where people are like trying to explore that world of happiness. Do you know that word of happiness? Yes, sex. And that's why you're told you need to be clean before and after. Imagine yourself, you didn't do that business inside there, the washroom, correctly, and you want to engage yourself into that action. If the Escherichia coli was present, if you didn't do your business correctly, you end up contacting the Escherichia because of that friction during that action. That's how you get infected with the UTI. Yes, via sexual activity. So every time, make sure you are clean if you are to involve yourself in those actions. Me, I don't know what are those. And so when the infection that normally affect the lower urinary tract is not treated, it's when it goes and ascends to the upper side, that is the ureter and the kidney. When the UTI affect the ureters, it can cause raw flow of the urine to the bladder, because imagine those bacteria, they have come from the bladder, and at this time they're increasing in numbers. They will block those pipes, that cause them the pipes that are getting the product from the kidney, that is the urine that flows to the bladder. It will narrow the ureters, and there will be low flow of urine to the bladder. So by the time the infection is getting there, you already have like even fever. At this point you can get fever, because the bacteria that is inside there, it is not supposed to be there, and it is causing a lot of harm. So the fever will be signaling you like there is something that is going on, and it is not supposed to be going on, and the infection has gone beyond the normal. And so at this point, I know you are eager to know, how do I know really if it is the UTI that is affecting me or it is something else? So it is very simple. If you have those signs and symptoms, don't treat yourself like going to the chemist, I have this and this. No, I would advise you, and I am advising you at this point, just go to the hospital and see a doctor. Explain all the signs and symptoms without leaving any single information, so that you can help the doctor know what is really ailing you. So if you go and explain all those signs that you are feeling, the discharge, the pain during urination, the doctor will send you to the laboratory. And in the laboratory, the lab technologist will give you a container to go and collect urine, because that is the sample that is used to be tested so that they can know if really you have the urinary tract infection. So when you go and you are given that container, you are supposed to collect the midstream urine. Midstream urine is whereby you go to the washroom, you urinate, then you hold. After you hold, take your container now and urinate inside the container. Then you hold. Now the rest of the urine you urinate it to the washroom. The urine that is called the midstream is that one that you are collecting in between the voiding process. Why are we collecting the midstream urine? Is because if you collect the first urine, it will be like somehow contaminated by the bacteria that are found around the place where the urine is coming out. So that's why you are advised to collect the midstream. After you collect the urine and take it back to the lab tech will do tests, urinalysis, and it involves macroscopic and microscopic. Macroscopic is what you can see, but it is not like use your naked eye to diagnose. Yes, you check the color of the urine. In case you have UTI, the urine, due to the changes of the normal system of the urinary, it will be somehow like cloudy. That is the first diagnosis that you do macroscopically. Then with the aid of a strip that is called a deep stick, they will be able to know the pH of your urine, the specific gravity of your urine, if there is protein in your urine, if there is red blood cells, white blood cells, nitrate, bilirubin, or that strip normally have all that parameters. In case of the UTI, the first sign that you have UTI, your nitrate might turn, it's normally turn pink. Let me just tell you, even though you don't know the color that normally turns, it will reflect, and that is positive. So from there you will proceed with the microscope, checking are there any bacteria inside the microscope. You just put the slide, the sediment of the urine after centrifuging, then you'll be able to check it in the microscope. From there you'll be able to see if there are yeast, if there are bacteria, if there are white blood cells. When you have the UTI, you know the UTI is an infection, and when there is an infection, white blood cell will come to fight the infection. That's why you'll find if you have that infection, you'll find the white blood cell there, because they have come in to fight the bacteria that is present there. So from there, most of the people, you'll go to the hospital, you'll be done urinalysis. When it keep coming and coming, you still do the urinalysis. No, if it get persistent, now you go to another test that we call the culture. The same midstream urine, if the culture was not done the same day, you will collect another urine. It will go through that process of macroscopic, microscopic, and then culture. In the culture, the sediment of your urine is inoculated into some plates that have some nutrients that will be able to grow certain kind of bacteria. We say, for example, it is Escherichia coli. When it is inoculated in that plate, it will go in a certain manner, it has some certain characteristics, and the lab tech will know this is Escherichia coli that is causing the UTI in you. If it is Proteus, they will know after they have grown, they have inoculated the urine in that caplet. They know this is Proteus, because there is every bacteria behave differently when it is grown in those medias. Escherichia coli will behave different from Proteus, will behave different from Klebsiella, will behave different from Pseudomonas aeruginosus. So they will be able to pick, oh, it is Escherichia coli. Then they will not stop from that. They will do a sensitivity test to know which drug they will give you for them to eradicate this Escherichia coli from that urinary system of yours. So they will take another plate with those. I will explain it as to medicine they normally put. So the medicine that has a wide space ni kama imekula, it has eaten the bacteria that is the one that is susceptible to eradicate the bacteria in your system. The one that has a shorter space, that one means like it is resistible. It can't. Am I saying the correct thing? No. Oh yes, I'm correct. Because if you have that large zone allowed that disc that is normally inoculated with some antibiotic, that means the bacteria will be killed by that antibiotic. But if there is no zone, it means that it is resistant. So the lab tech will indicate the ones that are susceptible, the antibiotic that is susceptible. What do I mean by susceptible? It will be able to eradicate the UTI. And that test doesn't normally take like, it is not instant. It is not a one-day test. Culture may take 3 to 5 days because you will have to culture overnight, then another overnight for sensitivity. So there is no at any given point that somebody will tell you they have done culture within the same day. That is not possible. So that is one way of eradicating the UTI, because it can really disturb you for the rest of your life if the doctor, or if you don't take that initiative of knowing which bacteria is ailing you. So my advice to you, if you suspect you have UTI, if you have it at this point and you have been going to the hospital or the chemist, you just take drugs without going and getting that culture test. It is high time that you go and take that culture test. Yes, it is expensive compared to the urinalysis, but what do you want for your health? You need a good health, and you don't want at some point in your life you be told you have kidney damage, because the more the bacteria are shedding from the urethra, bladder, ureters, finally they will get themselves to the kidney, and they will destroy the kidney, and the kidney will not function as it is supposed to function. So if you have a recurring UTI, go and request for a culture test to be done so that they will know exactly the bacteria that ailing you, and you will be given the exact antibiotic that will eradicate the UTI. So please don't stay there and just take medicine without doing that test. It is a culture test for urine. That is the one that will make you know that which bacteria is ailing you. And now we go into prevention. How can you prevent the urinary tract infection? One, it is staying hydrated. I repeat, staying hydrated. And for those who have not visited my channel, this channel, and watch my previous video. I talked about benefit of drinking water, and it is the same with benefit of staying hydrated. You see, water is coming into our next topic. So go listen to that topic of that day in my previous video. Then you come, you connect here, because the more you stay hydrated, the more you'll have the urge to visit the washroom, and the moment you void will flush out the bacteria inside the bladder. Another thing, make it a habit to urinate in between 3 to 4 hours. Don't extend like ili unasikia umefinywa, don't ati ufanyange hadi hivi, hapana. The moment you feel like you need to visit the washroom to go and urinate, please go, to avoid the bacteria getting more and more in urine. So when you flush them, you flush even, imagine you had some E. coli just by a slight maybe mistake down there. When you go and urinate within those hours, you will be able to flush out the bacteria, and with that, it will not colonize your urethra and all that. So you'll be at a safe point of not contacting the urinary tract infection. And another prevention measure is the wiping technique. Always use the front back technique to wipe yourself when you visit the washroom, to avoid introducing the bacteria that are not supposed to be in the urethra inside the urethra. Even after sexual activity, which I told you I don't know what is that, you can always visit the washroom and urinate. By urinating, you flush some of the bacteria that might have entered there during that movement and all that friction during that activity. So you will be required to urinate. Another thing, the underwear you wear. Don't go and just buy an underwear and wear. Make sure it is cotton, because the cotton underwear will absorb the moisture, and the moisture will not remain there. If you wear an iron one, the wetness will just be there, and that one will encourage the bacteria that are there to get in and cause the infection. So make sure each and every time you have bought cotton underwear. It is not a must to be full at all of it is cotton. There is this part that is normally at the center. Make sure it is cotton so that it will absorb the moisture during the sweat and all that. Another thing, for those who wear tight clothing, please stop. It's like you are suffocating your organ. You are suffocating your organ. Give your organ space to breathe. Stop wearing tight clothes. Another thing, don't go and clean that body part of yours. I feel like it is dirty. No, don't. It cleans itself. God has a way of making the creation wonderful and all that. So by the time it is moving all those discharge, the normal discharge, that is, it is doing its cleaning process. So don't do that dodging. It is called dodging. Yeah, don't introduce other things. At sijui you want your vagina to be tight, sijui you want what. No, don't do that. Just let the organ clean itself with how it was created by God. Another thing, stop using scented soap. And first, to be sincere, you are not even supposed to clean that part with the soap. Clean water, clean warm water is just enough. It's just enough, and I am talking this from experience. Go to the bathroom. Before you start bathing, just have that clean towel of yours. You clean that part very well without soap. Without soap, I mean, concentrate on that part. Clean it without soap. Then you can clean the rest of your body. Just try that and you will see. That part I need a lot of, you need to buy which type of soap to clean your body part. It is what part? That part, you don't need soap to clean it. From today, I'm advising you from my experience, just use clean warm water to clean it, and you see the difference. That part doesn't require all flavor of soap, no. So eat a balanced diet. A balanced diet will give you a strong immune system. When you have a strong immune system, even if the bacteria at some point get themselves there, they will be eradicated easy because you have a strong immune system. And the soldiers that normally fight the infection, that is the white blood cells, they will fight the infection faster. That's why you need a strong, balanced diet. Generally, eat well, hydrate yourself well, and your system will thank you. Even when you had contact a disease or you had contacted, it will be cleared easily. For those who are drinking alcohol, I don't know the fun in alcohol, but for those who take it, they know the fun. But don't drink excess alcohol. Let me tell you, for those who drink alcohol, it is not of any nutrition value into our body. The moment you take, you urinate, and the more you take, the more you urinate. I know some people have a testimony here. The more you take it, the more you frequently visit the washroom. And where is it being drained from? Your kidneys will be affected and all the system. Itachomwa na hiyo pombe. So by the moment you get the infection, it will be faster growing bacteria because your system is already destroyed. So stop drinking excess alcohol, and if you can, kindly stop drinking alcohol because it will do more harm to your body. And above all, stay active. What do I mean by active? Exercise. That's why you are told exercises are good for your body. When you exercise, you are making your body like active. It's like you are changamshaling your body. Even its function, itaka imechangamka. And your immune system will improve. And in case of any infection, it will be able to be eradicated easily kama umecontact. So today, I'm urging you, for those who have not contacted the UTIs, do the correct measures. Kama if it is the other wears, wear the correct one. Continue wearing the correct one. For those who already feel like they have those symptoms, let me repeat them. The discharge, that is somehow smelly and change in color. Burning sensation during urinating, kuchoma chomwa. Pelvic pressure, lower abdominal pain. Kindly visit the doctor and explain all that. The doctors will help you get out of that infection. For those who have recurring symptoms and they already know it is a UTI, kindly go back to the hospital, see the doctor, and request him or her if you can do a culture test, because it has been days and days of treatment and nothing seems to work. They will not refuse. They will give you that culture test. So let us eradicate the UTI by knowing what we are supposed to do and doing the right tests that are required and knowing the exact airing of the UTI. That is how you eradicate the UTI. So with that being said, I want to thank you very much for being part of my channel. Continue listening and learning from this health topic, and always, if you have not subscribed, kindly subscribe. If you have already subscribed, thank you very much and keep tuned in this channel. Always like my video. Kulike is that kadam that normally like this. Tafadhali usiniwekee aka ni niwekee kidole. This is the one that you click so that useme have liked my video. So thank you very much, and till the next health topic, it's a bye bye for now. Stay healthy.